I'm John Cooper. I'm consultant veterinary pathologist at Jersey Wildlife Preservation Trust in the British Channel Isles, which lie just off the coast of France. And I'd like to acknowledge the support of my colleagues at Jersey Wildlife Preservation Trust, particularly my veterinary colleagues Tony Allchurch and Chris Dutton, and other members of staff there who've helped and encouraged me in this and other presentations. The topic is the role of pathology in wildlife health monitoring, and if I could have the first slide, please. It's important to look at health in global terms. Wildlife health, wild animal health, is of course part of animal health, but in turn that and human health and plant health, ecosystem health, many other types of health are part of the overall health of our planet, global health. And this is a theme that I shall come back to later on. I'm emphasizing the term health because I believe and I know that there's a difference between disease and health. And I'm promoting the concept of health as being a positive concept and one that we should be concerned with not only with wildlife but with other aspects of veterinary medicine. If we look at definitions, health is defined in a positive way. These are dictionary definitions as soundness or the condition of the body. Disease, of course, from two English words, dis-ease, lack of ease, means unhealthy condition of the body or some part thereof, illness or sickness. As veterinarians and as veterinary pathologists, we're concerned with studying disease, the definition of pathology, the study of disease. But today, although I should be talking about disease, I particularly want to emphasize health as being the positive concept and something that increasingly we can quantify and we can use in practical veterinary medicine with wildlife. Now let's look first of all at the background to wildlife health and disease. And the first thing is that we acknowledge, we recognize that disease, the negative side of this subject, both infectious and non-infectious diseases, can occur in wildlife, have occurred in wildlife, and continue to be significant in wildlife. When we look at infectious agents, for example, this is the traditional breakdown of some of the microorganisms, some of the pathogens or potential pathogens that can cause disease in all of the animal kingdom, everything from invertebrates to primates, including wildlife, and we have many examples of these in wildlife hosts. This is perhaps the old-fashioned approach to pathogens. Wildlife biologists nowadays are using different terminology. And in particular, the work of Hudson and Dobson 10 years ago, both wildlife biologists, has led me and others to start using their terms of microparasite and macroparasite when talking about infectious agents in wildlife. Hudson and Dobson, incidentally, have put these organisms into the same general category as the others that you see here, parasitoids, competitors and predators, as being other organisms that can influence the survival and fecundity and so on of animals. But Hudson and Dobson define a microparasite as a single-celled organism. So it could be a bacterium, a single-celled fungus, a protozoan, a virus, etc., as opposed to the macroparasites, which are the metazoan, the multi-celled organisms, the helminths, the arthropods, etc., etc. So during this lecture, I shall use the term microparasite and macroparasite in order to build a bridge with wildlife biologists who use these terms routinely. Right, well, let's have a look, first of all, at some examples of microparasites and macroparasites affecting wildlife, the negative, the disease side of it. Here, for example, is a European goshawk, one of a small population in Scotland that are gradually expanding in numbers, but their spread and their success has been very hampered by trichomoniasis, Trichomonas gallinae infection. You can't see it in this particular bird because it has, at the moment, a subclinical infection. But here we have a protozoan infection that is playing a significant part in a wild bird and indeed in its recovery program. It's not, of course, just mammals and birds. Here's a chameleon, an East African chameleon with a bacterial abscess on the mandible, a gram-negative bacterial abscess, not at all uncommon in wild, free-living reptiles. And as I said earlier, when we're talking about wildlife health, we're talking about the whole animal kingdom. So we can also look at invertebrates. Here's a giant water scorpion, an African species, a typical arthropod. It has here a cluster of blood-sucking mites. The blood of invertebrates, of course, arthropods is hemolymph, and these mites are attached. The junctions between the shields of chitin, they're actually sucking the hemolymph. So these sort of organisms can be significant throughout the animal kingdom. We also have non-infectious agents, of course, that are significant in wildlife. There are many examples of those. We have oiling of seabirds, for example. This is a guillemot. The pathologist will recognize not only that here we have just traces of oil on the outside, but it's very possible that there's internal pathology here affecting intestine, liver, kidney, etc. But this, of course, is a non-infectious agent causing morbidity and, in this case, mortality in wild birds. We see developmental abnormalities in wildlife. Here are two East African tortoises, land tortoises, one quite normal, a recent hatchling, and here there are two conjoined twins, Siamese twins. And there were two eggs that produced these in this particular clutch. Developmental abnormalities, possibly genetic in origin, possibly related to temperature of incubation, but nevertheless non-infectious disease in free-living wild animals. And then we have other examples also where rather than just being an infectious or a non-infectious agent, we have a combination. This is a European toad, Bufo bufo, one of a group in a collection that deteriorated, and a number were submitted for post-mortem examination. It is quite clearly a totally emaciated toad, very poor condition. It's got pale white skin lesions. There's some fungal infection, probably saprolegnia on the surface there. To all intents and purposes, an emaciated amphibian, cause of death, inanition, etc. But in fact, this is a victim of what is called the maladaptation syndrome. The maladaptation syndrome was a term coined by Cowan here in the United States in the 60s to describe the combination of clinical signs and pathological lesions that cold-blooded vertebrates, ectothermic vertebrates in particular, can show as a result of initially an adverse environment. And as the slide shows, the toad, for example, is unable to adapt to its environment because it's an ectotherm or because the substrate is inadequate, etc. As a result, it develops anorexia, behavioral abnormalities, then secondary lesions, secondary infection, parasitism, then inanition develops and further infection and parasitic disease and death. So one has this spiral of events in which it's difficult to say what is the infectious agent and what is the non-infectious agent. They're really working together to produce the maladaptation syndrome. And although we have recognized this since its description in the 60s for 30 years as being a feature of many species, not necessarily ectotherms in captivity, increasingly we believe that this can be also a feature of free-living wildlife. For example, here, this is a scene from France, and here there's a very, very damaged ecosystem where what was once a small stream full of life, crustaceans, amphibians, etc., has been damaged. There's been pollution, etc., etc., and we are increasingly recognizing that the maladaptation syndrome can occur in free-living animals when the environment is under pressure as well. And this, of course, comes back to ecosystem health, because here we have an ecosystem that is very definitely not in good health. Now let's move on from that then, having talked a little bit about disease in wildlife, and I will return to it briefly later. I want to distinguish between diagnosis and health monitoring, because the subject of this lecture is health monitoring of wildlife and the role of pathology, and that is different from diagnosis. During the course of health monitoring, we may indeed diagnose disease, but we are, in most cases, monitoring the health of apparently normal, healthy animals. Diagnosis of disease is where disease is suspected and is very much the remit of the veterinarian. Health monitoring, on the other hand, I would argue, is something that involves people from different disciplines, with the veterinarian a key part of it, but not the only player. So health monitoring, we are in most cases looking at presumed healthy animals and looking for signs of underlying disease or signs, hematological values, whatever, that might be indicative that the health status of that animal is in some way threatened. Right, well, why is health monitoring important? Why is health monitoring of wildlife important? Well, first of all, health monitoring of wildlife is important because it enables us to detect, as I've just said, at an early stage, diseases of wildlife at an early stage before clinical signs become obvious. This early detection of disease may involve common species. For example, 10 years ago in Northern Europe, we had a die-off of seals due to morbillivirus. Large numbers died off the coast of England, the Netherlands, etc. And many of us were involved, as you see here, in post-mortem examinations and diagnostic work. Since then, however, there's regular health monitoring of these seal populations, and we are in a strong position to pick up early signs of morbillivirus infection or anything else that might threaten the population before clinical signs are seen and before morbidity and mortality rear their ugly heads. And not only with the common species, or relatively common, such as those, we increasingly have recognized over the past decade that there is a danger of infectious disease to threatened populations of animals. This book, for example, that resulted from a conference in Canada in 1986, contains a collection of papers relating to the threat to particularly island populations of birds, some of them amongst the world's rarest birds, from the introduction of infectious disease. And as a result of the awareness that was prompted by this conference and the book that came from it, we've been able to introduce health monitoring programs for many of these populations of isolated populations of birds, so that these bird populations can be checked and there can be some form of preventive medicine program at an early stage. But there are, of course, other reasons why health monitoring is important, and some of these are economic ones and therefore important politically. They have some political punch. For example, we recognize and have for some time that wildlife can be a source of infectious disease to domestic stock. This scene from the Rift Valley in Kenya, for example, shows some cattle grazing by the roadside, but also you can see some zebra in the background, a reminder that there can be transfer of infectious agents between one and the other, and sometimes the results of that contact can be serious. This, for example, from the Serengeti National Park, is a calf with bovine malignant catarrhal fever. It and some others had contracted it from the wildebeest, and the wildebeest, which carry the virus, had been recognized by the Maasai tribe in East Africa as a source of this and other infectious diseases for a long, long time. So there's nothing new about this, but it's more leverage for promoting the fact that we should be more concerned about wildlife disease. The other aspect that is of economic and to a certain extent political importance about wildlife disease is that many of the infectious diseases of wildlife are zoonoses or potential zoonoses. And the animals responsible can range from being the weaver birds in Africa that share their breakfast with you when you're on safari, through to rather more sinister threats such as primates, which may contaminate water, as is happening here, or possibly bite people, etc., with the attendant risk of particularly viruses that are very important. And work on wildlife is also, and wildlife disease and wildlife health is also very important in terms of its relationship to captive populations. There's been a tendency in the past to think of wild, non-domesticated animals as either being in captivity or being free living. But in fact, with the pressure on habitat in many parts of the world, many reserves now are just islands of habitat, very often with fences and so on, with a lot of contact between with people and domestic stock. The actual distinction between captive populations and free-living populations becomes less and less, and as a result, our work on free-living wild animals may be relevant to captive ones and vice versa. We have examples here. For example, this is a confiscated chimpanzee from Zaire, now the Congo in Central Africa, one that had been confiscated by the authorities and was destined for a sanctuary in Uganda. But of course, what was a free-living animal such as this could present a risk, particularly in terms of viruses and other organisms, to those in captivity. The other way round is illustrated with reference to reptiles, particularly tortoises. This is an East African tortoise, but it shows a nasal lesion here, and ocular lesions, and upper respiratory disease syndrome, often called by hobbyists runny nose syndrome. We know from the work done here in the United States on the desert and gopher tortoises that infectious diseases, particularly those associated with mycoplasma species in reptiles, in tortoises, can be introduced into the wild, into the free-living wild population, and can present a threat to the survival, the long-term survival of those animals. So this link between free-living and captive animals mustn't be underestimated. They are much closer nowadays than we often realize. But these are examples of clinical disease, or where the presence of infectious organisms can be readily detected, all those that I've shown you. And also, in most cases, the relevance of those organisms that we isolate are known. But what about the more subtle, if you like, the invisible effects, particularly of microorganisms on wildlife? And I'm reminded of the quotation of Paracelsus, the great Swiss scientist, the chemist from the 17th century, who, teaching medical students, said to them, "The physician should know the invisible as well as the visible." And I would suggest that that should really be our maxim in wildlife pathology. We should be looking for the invisible signs, not just for the ones that are on the surface, which are fairly readily detected and indeed are so on a regular basis. If I give an example, let's have a look at this. This is a Grant's gazelle in the Serengeti National Park in Tanzania. One looks at this in its natural habitat, pretty well divorced from human contact and domesticated animals and so on, but not absolutely. One looks at that and we can ask ourselves, what's the significance of the internal micro and macro parasites that this gazelle harbours? Do these micro and macro parasites play any part in the regulation of animal numbers of this and indeed other species? We can ask ourselves, have wildlife biologists been right to concentrate on competition for food and predation when assessing population dynamics of this and other species, or should perhaps infectious agents be included in part of the discussion and the debate? And perhaps the last question which is relevant is, are the following perhaps often more important in terms of wildlife and regulation of wildlife numbers than the spectacular diseases and deaths to which I've referred earlier in the lecture? And I'm thinking of such things as condition, performance, survival and productivity. These are features that are often not easy to assess. We don't necessarily see clinical signs. We certainly don't see deaths associated with these. But a wild animal, a Grant's gazelle or anything else that is lower in condition than another, or performs less well, or survives less long, or produces fewer young, or those young survive for less time, may well be at a disadvantage in relationship to its fellows, and therefore we should be taking those infectious agents very, very seriously. Now, these all can, in theory, be affected by micro and macro parasites, and also, of course, by non-infectious factors, sublethal toxicity, nutritional deficiency. All of those things could produce these could affect these parameters in free-living wildlife. But we have even more subtle effects that might be relevant, and one of them was the one that was proposed by Hamilton and Zook in 1981 and 1982. This is a scanning electron microscope of a Malaphagian louse, a bird louse, and it's just to introduce the topic. Hamilton and Zook postulated 15 years ago that in working with birds, that the choice of a mate, particularly the choice by a female bird of a mate, could be influenced by the health and the vigour of the male bird. And they in turn said the health and vigour of the male bird might be reflected in the quality of the plumage of that particular bird. So if I just put in some East African pelicans to illustrate birds, they said, Hamilton and Zook, that the male birds that had the brightest plumage, in terms of the best quality plumage, etc., tended to be those that had lower parasite numbers. And they, in turn, they said, would tend to be selected by the female bird, and thus the tendency was for birds with a lower numbers of parasites to be selection to be in their certainly sexual selection to be in their favour. Now, there's been much debate about this and many publications, and the Hamilton and Zook theory of host-parasite relations and their impact on, or possible impact on mate selection and competition and so on, has now been extended into reptiles and possibly other species. And the publications, some of them support the hypothesis and some of them don't. But nevertheless, I would argue that these sort of subtle effects, the sort of things that have been put forward by Hamilton and Zook, warrant attention by pathologists. And certainly this is a fertile field for collaborative research between veterinary pathologists and wildlife biologists, parasitologists and so on, and something that we ought to pursue with considerable vigour. Well, how do we monitor the health of wildlife? Well, first of all, it's worth pointing out that there are two ways of monitoring. One is opportunistic and the other is planned. Opportunistic, of course, means we take every opportunity to get samples from wild animals when they have to be handled, translocated, when they're found dead, that sort of thing. Planned monitoring, of course, means that we decide to go out and immobilise 10 wildebeest and take blood samples or whatever, possibly even kill small numbers of animals in order to apparently normal animals, in order to get the material that we want. I would certainly advocate that opportunistic monitoring should be always, not just in the back of our minds, but the front of our minds, because the opportunities to get material from wildlife are often few and far between. Planned monitoring can be rather more difficult. The other aspect of monitoring is that there are three rough divisions. This is my terminology and open to some criticism, but there is clinical monitoring. In other words, we have the live animal in the hand and we can examine and take samples and so on. There is post-mortem monitoring, when we have the dead animal in the hand and can do our necropsy and our supporting laboratory tests and so on. And there's environmental monitoring, which hopefully is self-explanatory. Let's have a look at clinical monitoring, and I would put clinical really in inverted commas. As I say, it means when the live animal can be handled and sampled. Now, obviously, the bird in the hand we can do, or any other sort of animal, we can do a great deal with. Here, for example, we have what is still the world's rarest species of pigeon, the pink pigeon from Mauritius. This is one of a number of individuals that were destined, from Jersey Zoo, were destined to go back to the island of Mauritius for the captive breeding and release program there. And it was obviously very important, even though these birds appeared perfectly normal and to all intents and purposes healthy, that samples were taken. So swabs are being taken here to look for trichomonas, which was mentioned earlier, but also to build up a picture of the oral flora, bacterial flora, etc., of these birds prior to their return to Mauritius. So that's an example of clinical monitoring. It's especially easy to do this sort of thing, of course, with captive animals, captive breeding programs, zoos, etc. But we can also, of course, do clinical monitoring of wild animals that we capture. At one level, it might be like this, a scene from Kenya last year, where a group of Kenyan ornithologists who are routinely bird ringing, that is bird banding, are being given instruction in how to take blood smears from these birds, so that in addition to their own work, ringing, banding the birds, we could build up some information on whether the birds that they were handling, some of which would be subsequently recaught, had normal hematological values, whether they had blood parasites and so on. An example of a certain amount of health monitoring possible by going out and actually catching your free-living wildlife. One can even take this further, of course, and not only capture wild animals, but recapture them later on. For example, another project in Kenya, in this case concerning the Kori bustard, which is one of the largest of the birds, and certainly one of the largest of the bustards, in the Rift Valley, involved attaching satellite transmitters to these bustards, which were subsequently released, and then by use of the satellite we were able to monitor the movement of these animals in the Rift Valley. Not only that, but we could recapture them if necessary, because we could locate them, as long as the transmitter and the satellite both functioned properly. During the course of the capture, as you can imagine, we collected ectoparasites, we did routine morphometrics, we collected feathers, we took blood samples, in other words, as much health monitoring as we could, and in the event of the bird being recaptured, we could do exactly the same again. So we have at our disposal these methods of clinical health monitoring which have much to commend them. But these methods that I've described have many disadvantages. And I think the main thing, of course, is that they can be a cause of stress to particularly a free-living wild animal, whether it's capture, putting a needle into a vein, collecting ectoparasites, doing measurements, etc. These are stressors which will undoubtedly lead to stress in the animal. That is not per se a bad thing, but we should obviously be asking ourselves, perhaps doing a cost-benefit analysis as to how acceptable it is to cause that stress to these wild animals, and indeed whether we're getting meaningful results under those circumstances. There is evidence, for example, that hematological values will be altered in these captured animals because of the stress of being chased and caught and so on. And sometimes the arguments are more profound and indeed more violent than that. These are African wild dogs, are seen from Tanzania, which has at the moment the largest population of wild dogs in Africa, but this is a species that is declining rapidly throughout the whole continent. The wild dog has now disappeared from the Serengeti National Park in Tanzania, and there is evidence, and a lot of debate about it, but nevertheless some evidence, that the immobilization and handling of wild dogs in the Serengeti National Park in order to put radio transmitters, collars on, may have resulted in stress and immunosuppression, and possibly, and this is the theory, possibly the development of clinical rabies, which then wiped out the wild dog population. Now, whether that's true or not, it's something that we should be thinking about. And so the trend nowadays, increasingly, in many parts of the world, is to think in terms of using minimally invasive health monitoring. In other words, not unnecessarily chasing, catching, bleeding, sampling wild animals. Now, this is this means less hands-on work, much more observation, and much more detective work. And this, of course, is where the pathologist can come in. Now, one of the projects, one that I've been involved with in Africa, that for 10 years has been practicing minimally invasive health monitoring, has been the project in Rwanda with the mountain gorillas. A very threatened subspecies, fewer than 650 left, and subject to all the problems and vagaries of political and social and military unrest, etc. Now, these mountain gorillas have been subjected, as I say, for 10 years to a veterinary health monitoring program, but it has been one that has been minimally invasive. And essentially, it's consisted of two things. One, observation. Because many of the groups are habituated, it means that not only tourists, but also veterinarians, and indeed my wife, as in the picture, can have close access to the gorillas, can observe them, can observe their behavior, look at their gait, look for evidence of nasal discharge, ocular discharge, how they're nursing their young, etc., and build up at least a clinical picture of the health and the demographic structure of this particular species. Now, obviously, this is only limited in terms of how much we can assess the health of those animals just on those clinical parameters. But, of course, it can be coupled with sample taking. And this is why I see the opportunities for the veterinary pathologist in health monitoring to be expanding. As there is more and more public and scientific concern about hands-on invasive health monitoring, catching of animals, risking some dying during immobilization, there is more opportunity for the pathologist to come in and say, right, we can do the detective work on samples, we can throw some light on the health of this particular species by using samples rather than having to touch the animal itself. And this indeed is the case with the mountain gorillas. The program has increasingly developed on the lines of observing, as I showed earlier, but also collecting samples. And here, for example, I'm training staff in the forests of Rwanda in the collection, the labelling of samples. Fecal samples have been collected for parasitology. Labelling is being carried out here on a swab for bacteriology, etc. And these samples are then transported to the lab, and there increasingly sophisticated techniques can be done to detect organisms, to investigate the food that the animals are getting, a variety of other things, and not only on feces, also on saliva, urine, blood, hair, etc., and to build up a picture of the health status of this particular population. The important thing here, though, which we must remember and which pathologists should be promoting, is that we are only going to get results that are meaningful and reproducible if we can standardize protocols and techniques. And that's everything from the sort of container we collect the sample in, the sort of transport medium that the swab is in, the temperature it's transported at, the medium that it's incubated on, whether we use concentrated salt, concentrated sugar for our flotation. All these sort of things are important, and we must be standardizing and drawing up standard protocols if these non-invasive, these techniques with a strong pathology orientation are going to prove their worth. Right, so all of what I've said so far, even this last bit, is in fact part of the clinical monitoring, in the sense that even this is taking samples from live animals. We have other aspects of monitoring, environmental monitoring being one of them. This is a developing discipline. It can range, for example, from the scene here, where there'd been, and this is actually where diseases occurred. It's perhaps not true monitoring, but here a large number of this is in Arabia, large numbers of toads had died in pools, and I'm not only collecting toads, but also collecting water samples in order to carry out tests on the water quality. It can apply elsewhere. Here, for example, a scene from France is a rubbish tip. No evidence of ill health in the wildlife at the moment, but this is where wild birds and mammals scavenge, and where toxic or even infectious material could very easily seep into waterways. So our environmental monitoring may be proactive, checking this sort of place and seeing what sort of effluent and so on is going into waterways and elsewhere before disaster actually strikes. Now, what about the third aspect of environmental monitoring? And that was the post-mortem environmental monitoring. And this is where, of course, there's a very definite role for veterinary pathologists. It involves post-mortem or necropsy techniques and all the associated supporting laboratory techniques that go with that. Again, in some cases, it may be that it starts off with a diagnostic riddle, a diagnostic puzzle. Here, for example, is a scene from Uganda where 4 mountain gorillas had been found dead under very mysterious circumstances, very decomposed, as you can see, and the post-mortem that I'm carrying out on this one at that stage was to ascertain the cause of death. These had actually been poached. But the opportunity to do post-mortem monitoring is there, because in addition to making the diagnosis, one can collect samples, material for routine screening tests and so on, and to a certain extent build up a database. These had been killed by poaching, by physical injuries, and therefore the tissues that were not too autolyzed certainly were useful as a starting point for our database. So we have many opportunities to do that sort of thing. Again, a different example. In the last El Nino incident a few years ago, large numbers of marine iguanas on the Galapagos Islands were found dead. And in collaboration with the biologists in that project, I investigated these, and we were able to show that these had in fact died of starvation. You'll see no internal fat here, because the rise in temperature, the temperature of the water had meant that the most appropriate foodstuffs were not available. But that was fine, that was our diagnosis, but it was also an unsurpassed opportunity to get tissues for histology, to do other investigations on histology, DNA studies, etc. In other words, once again, to build up information about this species. But we can, of course, also do post-mortem health monitoring in an opportunistic way. For example, when an animal is found dead, here's a buffalo by the road in East Africa, it's not only a chance, little doubt about the cause of death here, this has been hit by a truck, but it is an opportunity to do some health monitoring as well. An example of that is the opening of the rumen, full as all African buffalo rumens are with paramphistomum flukes, but not just to record these things, but to start quantifying it, counting parasites, seeing if we can correlate them with lesions, see if we can correlate them with hematological, biochemical parameters, etc., see if we can link them with condition. The veterinary pathologists have not been, in my view, sufficiently enterprising in terms of trying to quantify changes and link changes in the past. They've been terribly keen on diagnosis and not necessarily on building up a database which could help us detect these more subtle factors and their impact on wildlife, to which I referred earlier. Now, both in the wild and in captivity, animals can, if necessary, be culled, can be killed for health monitoring. I have to say, I think one should only embark upon this with some caution and sensitivity when it's really necessary, because quite often opportunistic health monitoring will yield a lot of information. But this can be done, and an example from a captive situation is one from the Jersey Zoo, Jersey Wildlife Preservation Trust, where we had to euthanize some Malagasy giant jumping rats, and you see one here on the table. This was for various welfare and management reasons, but these were supposedly healthy animals, and it provided a superb opportunity on our training program, and you see a nice international group here on our training program to provide training in post-mortem technique, of course, but also in not ascertaining why the animal died. We all know why it died. It died of an overdose of a barbiturate, but to weigh organs, to select tissues, to count parasites, to correlate parasite numbers with other parameters, etc., and indeed, in the case of a very unusual species such as this, to build up a database of normal anatomy, normal histology, etc. Now, a key part of post-mortem, or if you like, pathology monitoring, in my view, is the development of reference collections. We are dealing with the whole animal kingdom when we're talking about wildlife. That means millions of species of animal, and really we're just scratching at the surface because we don't have information about normality in most of these. So reference collections can be of great value, and they can be made up of carcasses, of other tissues, of paraffin blocks, of slides, of radiographs, of ECG tracings, whatever it happens to be, essentially pathology, but clinical data as well. This, for example, is part of the mascarine collection, which we now maintain at Jersey Zoo, when it was in London, England. And this is a collection that was set up 25 years ago in conjunction with the projects on the island of Mauritius and the adjacent islands in the Indian Ocean, dealing with some of the world's rarest mammals and birds and reptiles. And as specimens were examined post-mortem, as samples were sent in, biopsies and so on, we started to build up the collection, and so we now have a quarter of a century's worth of material, mainly in formalin, but some in alcohol and some frozen, which we can go back to do retrospective studies, etc. It's resulted, for example, in our being able to go back and do retrospective radiological studies on animals going back many, many years to look for evidence of underlying metabolic bone disease, healed fractures, these sort of things. And now a variety of other studies are being undertaken in pathology and even to a certain extent in DNA studies, although that's been a bit hampered by the fact that much of our material has been in formalin. Nevertheless, it does give us a chance to have material that build and develop a database, and as I say, for ourselves and others to go back to later on. And in all of the work that I'm describing here, in terms of post-mortem health monitoring, there is the question of the specimens that we take. And when we take specimens from a post-mortem case, then of course they're going to go through a whole range of procedures. You're going to have to select the right specimen, collect it properly, transport it properly, receive it properly in the lab, process it properly in the lab, and possibly send it for referral elsewhere. There are all these steps between getting the sample in the field and actually coming out with an opinion, which needn't be a diagnosis, an opinion, a description of your sample later on. And at each stage things can go wrong, and at each stage stage we should be trying to standardize protocols. I emphasize this because in contrast to domesticated animals, with wild animals we may only have one opportunity to get a sample, this opportunistic sampling. The animal is caught in a net, a chance to get a blood sample, a chance to take a skin scraping, a chance to take a biopsy. Once the animal is released, we may never get it again. So we can do a lot of harm if we don't have proper protocols and don't follow those every time, because the sample is unique and is unlikely to be something we can get again. So, and we have to think about it in terms also of the legality of the sort of work we're doing. We're going to be collecting samples, possibly sending them to colleagues for opinions. This is how not to send a pathological sample. This is a fish for post-mortem examination that went through the Royal Mail in Britain and arrived on my desk like this. It wasn't wildlife health monitoring, but it tells a sad, rather sorry story. We have to remember national and international regulations relating to that sort of thing if we're going to be practicing our wildlife pathology in a professional way. And there's other legislation we have to think about. For example, endangered species legislation, CITES, the Washington Convention. It is not just living and dead whole animals that are covered by CITES. Yes, these we would not think of transporting live or dead from the United States to Britain or vice versa unless we had the right permit. But the CITES regulations specifically state that recognizable derivatives are also covered. And that can be our blood smear, even a fixed blood smear on a slide. It can be our piece of tissue, a histological section. It can be various tiny portions of an animal which would not appear to put the species at risk, but are legally recognizable derivatives. And I would argue we should be doing this within the law, getting the right permits, because otherwise wildlife pathology will suffer a loss of reputation and credibility. So what, insofar as this subject is concerned, are the future needs? The future needs of wildlife health monitoring, but particularly the role of the pathologist in this. Well, the first one is that we do need to promote awareness of the importance of monitoring wildlife and the importance of a multidisciplinary approach. So awareness is the first important thing. The second thing is that we should be introducing health monitoring into all programs concerning wildlife. Here it states health monitoring is an integral part of animal management, and that can mean management in the wild as well as in captivity, and is essential before animals are translocated, introduced or reintroduced for the reasons I said before. So that's the second thing. And the third important point for the future is recognition that health monitoring is interdisciplinary. I said at the beginning that diagnosis of wildlife disease is still very much the remit, the preserve of the veterinarian, and that's right and proper. But when we come to health monitoring, and the many aspects of this that I've touched upon in the lecture, of observation, of understanding animal behavior, of sample collection, of demography, of analysing behaviour and movement patterns in wild animals, then obviously other disciplines are involved. So if we have wildlife health in the middle, of course we have veterinarians there, but we have researchers, field biologists, amateur naturalists, local and national bodies, rehabilitators, and the list is endless. And of course the veterinarians will include veterinary pathologists, which is the main thrust of what I'm saying in this lecture. Pathologists are, I believe, a key component in wildlife health. But I also believe that until recently, they've rarely been involved, or their approach has perhaps been too diagnostic and not so much investigative in terms of underlying factors that may affect population dynamics and so on. So the pathologist is, in my view, vital. And the famous physician, Sir William Osler, when teaching his students, and he was training, of course, medical physicians, would say to them, as is your pathology, so is your practice. But I would say that this also applies to wildlife health monitoring. Good pathology will lead to good practice and good techniques, which will in turn contribute to promoting both ecosystem and global health. Thank you very much.